The last new GP practice set up in the Lothians was in 2003. The population increase isn't uncontrolled. The planning department deals with proposals for new builds, flats and houses changing into multiple occupancy lets and that sort of thing. But there's no mechanism for the planning department to feed data to the health service. So there's an absolute wall in planning there. We've set out to put together a planning tool that will express in geographic and numerical terms the current situation of population distribution and distribution of general medical services, that's GP practices, along with projected changes so that planners can actually look in detail about what's happening, where services are over capacity already and where they soon will be. So we knew that this would not be completed this weekend. We're projecting by end of the first week of next month. But we've got some data already aggregated from the Information and Statistics Division of the NHS, from other information about GP practices, from the Scottish Neighbourhood Survey figures and numbers, and we're working on scraped data from the planning the council planning websites. So we've put together some visualizations, and Daniel will take over now to show what we've got.
Thanks, Daniel.
Hello. So we collected data from a variety of places
because there's a very rich data sets out there. The ISD has information on GP practices, practice size, number of doctors. The Scottish Neighbourhood Statistics has geographic data on layouts of postcodes and on demographic changes. Pulled in these data sets, brought them in together and started plotting them with OpenStreetMap using Leaflet.js to do our plotting. And what we're seeing here is GP practices across Scotland and where they are feeling the strain. So it's just a blob for each GP practice, and we've put a simple colour coding on them based on how many patients each practice is looking after. The blues are the ones with a high doctor-to-patient ratio, so not many patients, and unsurprisingly, those are the rural areas where obviously transport comes into play. And then if we zoom in, the reds tend to be a lot around Aberdeen, actually. There's some practices there which I don't know if that's a local effect to do with the Aberdeen industry. There's a cluster of very densely populated practices where a handful of GPs is fielding a lot of people. After Aberdeen, unfortunately, the next area which is experiencing heavy load is the Lothians. Here's Edinburgh with more than its fair share of red dots, which are the practices with lots of patients. I stress this is a very quick and dirty visualization that we've done here today. It's a first pass over what's some very rich data sets. Stephen and Ali back there have been looking at the more interesting things we can do when we bring in things like looking at the demographic splits, which is there. And then the next goal of the project is not just to look at the current situation, which of course ISD are well aware of, but to factor in the demographic changes and also localised effects such as where there's a new build going up. So when quarter mile or a big development gets built, data on that goes into council planning, which Joe has been looking at scrapers on Scraper Wiki, which will collect that data out. And then you can see, right, here's an area that's okay now, but in a few years' time, it's suddenly going to be under a lot more pressure. So this is an area where we need to start planning now if our provisioning is going to be correct in the future. Right, and that is where we've got to now.
Questions? Yes, no, I'll ask them. I don't want that back in. So when you say planning, you mean the city council planning, doesn't it?
Yes, yes.
And when you say the NHS, that's a separate quango. So you're having to talk to these two quangos and convince them of the power of open source.
Yeah.
It's hard enough to convince one of the power of open source.
Yeah. Well, to be honest, that's sort of advocacy is a secondary goal. But my belief there is that you convince people by showing them something that works to their advantage, and it's only through that they then get interested in the more general concept of free and open source software and open data, when they see that it actually does something for them.
There's also no need for them to buy into this as software they're going to install on their own services. It's data which they can look at the outputs and understand the outputs of.
There's another factor there, which is that we're trying to make this as generally applicable as possible, not just an Edinburgh Roadman's tool. But the limitation on that generality is the fact that we're having to scrape data from council planning websites, which are particular to each council, even within the Lothians. So there is if we're being optimistic, we can imagine, for instance, someone from another council or area seeing this and thinking, "Oh, I wish we could do that as well." And that would be an impetus towards more systematic handling and presentation of data.
Can you foresee any unintended consequences of having this kind of data available in terms of planners or the health board or just the public in general actively looking not to move into areas that are predicted to become overcapacity, and whether that might be seen as a negative thing?
I'm not sure that I can see this having an effect on the behaviour of the general public, because I think that's much more, and I can't back this up with data, but I think that's much more a factor of availability and cost of housing. Whether it would allow malevolent planners within the NHS or the council to be more effectively malevolent, I don't know. But if it makes things more public, then perhaps that's a buffer against more effective Machiavellians.
People use similar data in our schools to choose where to live.
I was going to speak to that. I think there is a real concern here, as you say, about schools, and I don't think capacity is one that would affect people's choices. When we were looking at the data, there is other data in there, such as mortality rates. And I think if you were putting up maps and league tables of mortality rates, you would have to consider people are going to make decisions on this and not necessarily wise or good decisions, because it's too simplified a view. So one of the things we found was, I can show you on the map, the GP practice where you are most likely to die. I don't think that's necessarily useful information. It's good that it's out there, but it's not something you want to... But capacity numbers and planning is a much drier subject. It's much less emotional. I don't think that risk is... if you were looking to buy a house and someone told you that one of the local clinics is a bit... the doctor-patient ratio is a bit high, would that really affect your decision if it was otherwise a good clinic?
Anecdotally, we know that the information on flood risk, for instance, is widely available, but it does not appear to influence people's choice of where they buy a house. It should, but it doesn't.
And on that, I might have to draw you to a close, but thank you so much.